Welcome to ScrubNotes, What to Say in Clinical Encounters. Whether you're heading into an OSCE, starting rotations, or just trying to feel less awkward talking to patients, this podcast is here to help you sound more organized, more confident, and more natural with patients without memorizing long scripts. I'm Kate, a medical student, and I break down simple, repeatable frameworks so you know exactly what to say in real clinical situations. Each episode is short, practical, and focused on one specific skill, with examples of what to actually say in real encounters so you can use it right away. All right, let's get into today's skill. Most medical students don't struggle because they don't know enough, they struggle because they don't know what to say. You walk into a room, you know the condition, you know the questions, but the words just don't come out clean, structured, or confident. And that's exactly what this podcast is here to help fix. This has been a huge pain point for me personally in my medical training. I found myself constantly trying to come up with the right way to start, the right way to transition, and the right way to explain things to patients. And I kept thinking, why is there no clear, repeatable way to do this? Most resources teach us what to ask and what to know, but not how to actually say it out loud in a way that feels natural and organized. And then I realized something about myself. I'm not great at memorizing long scripts, but I am pretty good at using simple, repeatable frameworks. So I started building one. And that's what this podcast is built around, helping you know what to say in real clinical encounters using a simple, scalable framework. So instead of memorizing dozens of scripts, you learn a structure that works across HPI, physical exams, sensitive conversations, and explaining conditions. That framework is called Connect. It's a simple way to guide almost any clinical interaction so you don't freeze, don't ramble, and you sound organized and confident. Let's walk through it. C is for context. So you tell the patient what you're about to do and why. So you might say something like, I'd like to ask you a few questions to better understand what's going on. This immediately makes you sound more structured. O is for open. So you want to invite or consent. Give the patient space to ask permission. Can you tell me more about that? Is it okay with you? N is for narrow. So you're going to clinically guide the conversation. Now you start to focus. You could say something like, you mentioned the pain started yesterday. Can you describe what it feels like? N is for navigate, so you want to transition smoothly. This is where a lot of people get stuck. You could say, I'm going to ask a few more specific questions. This keeps things from feeling abrupt or awkward. E is for ease. You're going to reassure and normalize here. So especially important for sensitive topics. You could start with, this is something we ask everyone, and then ask that question. C is to confirm, so you want to check the patient's understanding, make sure they're with you on this. You could ask, does this make sense? Any questions before we continue? And T is to tie it all together, is to close and move forward. So you want to end cleanly. You could say, great, let's move on to the exam. In future episodes, we're going to apply this to real scenarios like how to start an HPI, how to introduce a physical exam, how to handle sensitive conversations, and how to explain medical concepts clearly. Each episode will be short, practical, and something you can actually use right away. If you've seen my other content, you know I focus on clinical reasoning, chief complaints, and how to think through cases. This is just the other half of that, because it's not just how you think, it's how you communicate that thinking in real time. If this is something you struggled with too, you're definitely not alone. And if you want more structured frameworks for OSCEs and clinical encounters, that's exactly what I focus on in ScrubNotes. That's it for today's episode. Great job showing up and putting in the reps. Whether this felt easy or a little uncomfortable, that's exactly where growth happens. This isn't about memorizing scripts, it's about building a system. If you found this helpful, take a second to follow or share it with a classmate. Let's make clinical communication a little less stressful for everyone. Thanks for listening. And keep practicing. You got this, future doc.